Hey guys, my name is Claudia Burns. I'm a physical therapist and I'm also a coach here at CrossFit Dirigo. And I want to talk a little bit today about stress urinary incontinence. So this is a topic that's gained a lot of popularity or a lot of media attention, especially in the CrossFit community. And I wanted to kind of dispel some myths and talk and be really upfront about it and kind of get it out in the open. What is it? How can we treat it and prevent it? So urinary incontinence is the inability to control your bladder. In the CrossFit community, or CrossFit, the big movement offenders are double unders, box jumps, any kind of heavy lift, or maybe even running. So during those activities, small amounts of urine can void. And a lot of people experience this. This isn't something to be necessarily ashamed about. Like, don't feel bad to talk. Like, it's happened to me. It's happened to a lot of the members of our gym that I've talked to, which is a big reason that I wanted to talk about it today. So I think starting out with it's normal. It makes sense for it to happen, but it's definitely not something that you have to live with. I think it's started to become this kind of like yellow badge of courage. Like, if you're not urinating a little bit, you're not trying hard, and that's definitely not the case. So there's definitely things that we can do to help kind of combat that and make your gym experience more comfortable and drier. Why does this happen? Okay, so we need to understand a little bit about the anatomy. So this obviously happens to women more than men, just from an anatomical standpoint. Our urethras are a lot shorter, and the opening is closer to the bladder. So basically, this is my very crude drawing here. We have a urinary bladder, and the urethra kind of comes down through the muscles of the pelvic floor, which are really just kind of, again, underneath the pelvis. It kind of holds all of your abdominal organs basically up. And it also is responsible for kind of keeping that urethra closed. So the pressure coming through here is going to help kind of close that. And basically the force of your pelvic floor has to combat the intra-abdominal force, so the pressure coming down. So not just actually the weight of your bladder, how full it is, but it's anything in your abdomen. So anytime that pressure is going to be increased, there's going to be a greater force by your pelvic floor muscles to kind of combat that. So when we get stress urinary incontinence, we basically have increased that intra-abdominal pressure just momentarily, and it overcomes the force that we can provide by our pelvic floor. So in preventing this, there's two ways we can come about it, which I'm going to talk about in a minute. So the last one is a little bit about who. So like I said, women more than men, typically, just because of anatomy, and it's really just across all age ranges. Again, like, we have the younger women in the gym, the middle-aged, and then the older women in the gym. I think this is something that people kind of associate with postpartum, which definitely happens more if you've had a baby or carried a baby to term. And even if you didn't have a vaginal delivery, if it was a C-section, just the stress and the weight of carrying a child through that 9 months and all that pressure down. Or if you had cesarean, but maybe you pushed for a couple hours, there's still a lot of damage to those muscles, and it can take months for them to really come back and get kind of nice and strong. So don't be discouraged if this happens to you. There's definitely things that, again, we can do to help prevent it. Yeah, so the biggest, and I'm going to go over this in a minute, and then I'm going to show you some exercises in a separate video with my lovely assistant, Melissa. But two of the things that we can try to do while we're exercising. So during heavy lifts, or even during double unders, we want to avoid doing a Valsalva maneuver, which is that kind of pushing down, bearing down, because that's going to increase your abdominal pressure and make it harder for your pelvic floor muscles to combat that. So you want a nice strong core, absolutely. What we're going to do for that is we're going to teach you a transverse abdominis activation and stabilize your core that way, and not just the pressure. The other thing we're going to do is I'm going to teach you pelvic floor strengthening exercises. In the media, and it's kind of commonly known as a Kegel. The Kegels are for everyone, men, women, everybody should do Kegels. And these actually, pelvic floor muscles, actually, the insertion point is on the transverse abdominis muscle, so it's really great to do these together. And I'm going to kind of help strengthen everything to combat this. So definitely don't go out, if you struggle with this, don't go out and buy pads for the gym, or if you really need that, absolutely do it. But it's a meantime. Like, in the meantime, also be strengthening this to combat that, because it's not something that you have to live with. It's not something that you need to be ashamed of, but it's also not something you need to be proud of. It tells you there's a problem and there's something that we can work on. So If you want any more information about women's health or pelvic floor strengthening, there's a lot of physical therapy clinics or physical therapists in the area that deal with this really specifically. So if it's something that you're struggling with and you try these exercises we're about to show you and you're still having issues or troubles, contact like a local physical therapist or approach me. I know a couple specifically who like to and are really good at helping women with this issue. Okay?